I'm Dr. Taylor Pollei, and I want to talk for a quick minute about surgical patients and who is not a good cosmetic surgical patient. This is something that patients regularly will ask. They'll say, am I a candidate for XYZ? I mean, I'm going to be brutally honest. A lot of what I do is not necessary surgery. Now, I do skin cancer reconstructions and functional eyelid and nasal surgery, sure, but this is not open heart surgery. This is not an aneurysm that's ready to rupture. And I always like to set that straight with patients out of the gate. You're here because you want to be, and the service and the quality of service that I provide is really geared towards that kind of concierge level, like customer service based patient care is really what I love, and it's really what my team loves and thrives at as well. So kind of setting that record straight from the beginning, I feel is very, very helpful. So as far as you being a good candidate for surgery really comes down to what bothers you, and is it something that a surgical outcome is obtainable, and is that going to give you what you're looking for? When patients come in, say for rhinoplasty with a big bump or kind of a bulbous tip or crookedness, it's very, very easy to say, hey, that is something we can totally fix. Now, my personal thought in that is I don't want to change fundamentally how you look or who you are. I just don't feel that's what plastic surgery is meant for. So can we get an outcome that gives you what you want while still keeping you with a natural outcome? Totally. And that's kind of the outcome that I'm geared towards. When it comes to things like lower facelifts or eyelids or mid-face or fat transfer or brow lifts, it all comes down to, is there enough aging process there? For brow lifts, do you have that ptosis or heaviness to your brows? It's kind of a yes or a no. And does it bother you enough to surgically fix? So a lot of patients, when they come in, they say, hey, this is what bothers me, but is there anything else? And I say, yeah, but what else bothers you? I really like to get from them what bothers them, because it's not about me. I'm the provider of the service. I kind of jokingly say to patients, hey, I deliver the pizza, you just tell me what you want on it. And I know that's kind of degrading a little what I do, but it's more the concept of what bothers you, because you are the one that's going to be wearing the outcome, and I want you to be happy. And once we have that open dialogue and communication, I find it's really easy to determine who's a good candidate for that cosmetic surgery that we're discussing.